How you doing?
Good. Actually, I'm just very glad to sit somewhere else and actually extend. What was I going to say? Oh, I am starting to get a lot of feeling back in here.
That's great.
It's still pretty numb on my knee, which I think is expected.
Mm-hmm.
But I was wondering, due to the movement, am I able to get a pain med?
Sure, I can ask your nurse. We just scan this. Sorry.
As well as a fluoxetine pill to take.
Sure.
That's my everyday medication. I just figured I'll take it eventually. Actually, as soon as I eat something, I have pears right here, which I despise pears, but I prefer to eat something before I take it.
Okay. Good.
I thought you were here until afternoon. What do you mean you're leaving?
I'm not leaving yet. No, I'm here till 11.
Oh, just a different tech person.
Oh yeah, nurse exchange. I'm here. So
nurse change. Okay,
yeah,
I see what you mean.
Julia. It will be somebody else.
Perfect. Okay. Oh, alright. Vitals done. Everything is normal. You can see I've gotten my blood pressure taken so many times. There's like little bits of bruising from how hard they have to have the cuff on. But it's okay. It's okay. I do have the surgery vlog to go up. Obviously when I get home and I'm into a good routine, I will then get it up eventually for you. But I thought I would just update you guys and keep you guys updated on my hospital stay. The first video is just going to be saying good morning, and then this is like the vlog. If I can add both, I will, but we'll see. Oh, well yeah, pretty good night's sleep. Only woken up, I think, twice for the vitals, temperature, you guys saw, blood pressure, all that jazz. They have to do that every couple hours just to make sure that, you're on the way of, healing and getting better and can soon get out of here. Some physical therapy that I do today hopefully means if I pass, I can get out of here and go home today. We'll have to wait and see. Molly May is doing well. I wanted to give you guys an update there. Maybe I'll incorporate a video of her also. Molly May is doing great. Sends me good morning videos and sends me lots of love. Can't wait to go home and snuggle my baby. And it's actually Richard and I's 2nd anniversary today. So happy anniversary, babe. Love you. And I love and appreciate all that you're doing to help me prep for the surgery. I'm proud of myself. I'm proud of you. I'm proud of us. And let's see what the next year does for us. Alright, enough with the gaga. Enough with the gushy gaga, but I know that you guys don't really mind that you've seen Richard in my vlogs before. But so far, the first night went well. So successful getting up to move, successful, night of sleep. Really, really nice melatonin and Tylenol. I took both and knocked me out until about only the times that I was actually woken up for vitals or needed to relieve myself. Other than that, I slept like a baby. I was probably out by a little after 10 after those meds kicked in enough. And that was nice. And I slept well until about 7 and then did my thing with going to the bathroom, like the actual bathroom right here. And here we are, waiting on breakfast. I ordered pancakes and bacon. That is my food that I ordered. Oh, I also have The Rice Krispie treat from my sister still here. Rice Krispie treat. She got me 2 from the vending machine yesterday. I ate 1 while they were here. My 2 sisters, Emily and Teresa, were here, and she got two of these. So I ate 1, and so they were later, maybe on the way home or something. But not too shabby in the hospital, really. Like, honestly, really not too shabby. I am going to be taking pain meds because, with the numbness wearing off, with the nerve block wearing off, I'm able to move my toes. It's pretty sore, so I do need some pain meds, as well as my fluoxetine that I take in the mornings. They're able to supply that. Talking to a nurse right now to get those in here, and we'll get them going. Oh, I slept with my door closed most of the night, just because, that made me more comfortable. Then the light that I had was actually from the bathroom, so that it wasn't like totally dark in here. But I am proud of myself. I got up and moved and was able to stretch. Sit up a little bit here, and I'm really happy. Hoping that physical therapy goes well. They're probably gonna have me get dressed in my regular clothes, which I can't wait to do, because I really kind of hate sleeping in gowns, because I was pretty chilly over the night, of course, just from the way that the blankets are. Let me just say, hospital blankets totally suck. I will just tell you the truth. Hospital blankets suck. But, you gotta do what you gotta do. I can ask for whatever I want. So I got actually extra blankets and extra pillows. Had my leg elevated most of the night, was able to move around and stretch, sleep as I normally would, just without minimal weight bearing on the right side, of course. And I know my hair's a mess, but next thing I want to hope to do after I eat is brush my teeth and get physical therapy done. Brush teeth and get dressed in regular clothes, and maybe talk about discharge. So we'll have to wait and see. All that noise is, like I said, I slept with my door closed most of the night, so didn't actually bother. Actually, all of the night, pretty much, I slept with my door shut, just because that's how I like to sleep, with the door shut. Ice water here. Cold ice water, so good. Especially just with a dry mouth, because you guys know I tend to sleep with my mouth open, so I'll sleep like that. And so ice water, and I'll take some pills in a little bit. Eat some breakfast, hopefully maybe by 8. I think they have breakfast around here, 8 or 8:30, so I have to wait a little bit, which is totally fine. I kind of like my meds to settle before I actually eat, so we'll go from there once the food gets here, after I take the medicine, for things to settle down, for my body to, do what it's supposed to do. But overall, I'm really, really happy. Surgery went really well. I get to see my doctor today, Dr. Dellenbaugh, who is also my orthopedic surgeon, who's also my orthopedist from Ortho New York, where I go for orthopedic appointments. And what I can tell is my foot is much more narrow instead of pushed out the way that the bunion was, and I had so much little room. Just say this is the bunion right here. I'll insert a picture of really kind of what they did, but with how the bunion was like this, it's now I have a lot more space at my foot, so it's just a lot more narrow instead of all curved in. It's nice and straight. Screws are in, plate and screws are in, so everything is nice and straight. Toes are in place, and with what I'm supposed to do with no weight bearing. 3 weeks no weight bearing, and then I come back after the 3 weeks, have the stitches removed, and then I'll be put in a camo boot, able to put weight on it and move around. And 3 weeks is a long time, but I have a feeling it'll just go by really fast, honestly. And the recovery time has started. Recovery time has started. I'm just overall happy as can be that the surgery is done, and I haven't had any vomiting or any issues. My night here was pretty successful. Slept nice and well, as comfortable as I could in a hospital bed. And overall, I think I've been a pretty good patient, if I do say so myself. But I just wanted to check in, this little morning vlog, if you will. I'll probably vlog when I get to leave home, whenever that is. I really don't know. It's up to the PT and my doctor if I can go home today or not. We will have to wait and see, but I think, crossing my fingers with what I just did walking. I wasn't filming, unfortunately, but with the way that I was going to the restroom with the nurse's assistant, or tech assistant rather, I'm pretty confident that hopefully things go well and I'm able to go home.